Hi, everyone. Thank you so much for tuning in to this session. I'm very excited to have an opportunity to have this one-on-one chat with a person who is quite expert in the topic we'll be talking about. I'd like to make a quick introduction to Jen Tolley. And Jen, if you could give us a little background on yourself, and then we'll get right into it.
Yeah. Hey there. Thanks so much for having me. I am Jen Tolley. I'm the head of omnichannel and digital marketing and content clearance in the US for UCB. Quite briefly, my history, I started my career in the advertising agency world in media, in pharma and in CPG, and then back in pharma. I joined GSK and I was in brand marketing for years. And then I also led content for GSK. And part of my role leading content was establishing our in-house creative agency, the full medical, legal, regulatory review process, and the end-to-end content operations of that process. And then lastly, all things omnichannel transformation as it relates to content. And I joined UCB about a year ago now. So nice to be here. Thanks for having me.
Well, fantastic. Thank you so much for being here, and really looking forward to getting your perspective on this topic because of all of the experiences that you've had here. I think look at this discussion from many different lenses, and so really interested to hear your thoughts on this. So I'd like to begin by laying out a premise that I think will be the basis for questions that'll follow. So let me put it like this. I think we see a marketing landscape that's evolving. For years, creating differentiated creative concepts, that's been the essence of establishing a brand's positioning and unique offerings, right? But it's no longer the endpoint that it had been in a purely advertising world. Rather, we see it more as like the starting block for creating this robust volume of content. And previously, the AORs, or agencies of record, were expected to produce like nearly 100% of the content requirements. But we've been seeing omnichannel pipes grow ever thirstier for personal, relevant content. Some estimates are saying that content creation is going to grow maybe 50% year over year. But of course, budgets are not going to rise at that level, if at all, right? So effectively, scaling a strategic content operation requires innovation, cost-efficient ways of working, and possibly even a new agency model altogether, a model that could provide scale while also allowing for the many occasions where more complex strategic, medical, creative resources would be called for. We've described this new type of agency as something that falls somewhere between the traditional agency of record, AOR, and the so-called tier 2 content organizations that offer scale at great efficiency. But those also typically lack the ability to flex into greater complexity on an ad hoc basis. So we've come up with a term for this fusion of AOR capabilities with efficient scaling capabilities. We're calling this the agency of scale, or AOS model. And so to begin with, I'd like to get your thoughts on, does this resonate with you at all?
Yeah, it's funny. The term agency of scale is new to me, but it makes a lot of sense. Yeah, it definitely resonates. I think as I reflect on my experience, the agency of record model is where we grew up in marketing, right? Like everything is a bright, shiny object. Everything is created net new. And that made a lot of sense for many years. And the value of excellent creative will continue to be there, right? It's still very, very important that at our core, fundamentally, we have great creative, and that often stems from an AOR. I think the world that we live in today, and where scale is so important, is that in order to deliver a better customer experience, we have to personalize content along the way. And so to your point, increasing our content volume, but needing to do so efficiently and without the same increase in budget to support it, we got to figure out a better way. And so agencies of scale, I mean, that makes a lot of sense to me, because ultimately agencies of record are wonderful. They are experts at what they do, but they're quite expensive because they are experts at what they do. So how can we create efficiencies, both in terms of speed to market, but also in terms of the cost of creating essentially exponential content to enable personalized experiences? I think evolving the agency ecosystem in favor of scale is definitely in process, underway, on the horizon.
Well, that's great. Thank you. So it's good to know that maybe this thinking is on the right path. Wondering if you could go a little bit deeper on some of the drivers of causing this shift, like some of the challenges that pharmaceutical companies in particular face that are making the demand for more content, more scalable, efficient content coming from agencies. You touched on it a little bit, but let's see if we can go a little deeper on this.
Yeah, it's a good question. I think so. First, it's all companies, not just pharma. It's all parts of companies. It's not just marketing. It's all partners. It's not just agencies, right? Like we live in a world where we are continually striving to drive efficiency, deliver efficient results, save money here, increase speed to market there, right? Like this exists across every single discipline within every single company, not just pharma, not just marketing, not just agencies. I think this resonates across the board. I think for pharma in particular, though, the trade-off and prioritization decisions that we have to make are so critically important because our profitability at the end of the day then is directly reinvested into research and development and into supporting our patients, finding future treatments, future cures, better supporting our patients. And that's why I love working in pharma. At the end of the day, there is a patient after everything that I do, right? Every investment that I make. And so efficiency is important no matter what industry you're in, but I think it's critically important that we're really thoughtful about being more efficient and making those prioritization and trade-off decisions within pharma in the spirit of, at the end of the day, serving our patient as best as we possibly can.
I love how you just turn that into bringing it back on the focus on the patient and something that we really need to keep in mind as we're doing any aspect of marketing and communications here. So, you were saying that this is something that all industries are facing, right? And certainly, if you've ever shopped on Amazon or any other website, you've been on the receiving end of a content scaling operation, right? So we all kind of understand what that means. Pharma does have its own requirements, and that comes with certain barriers as well. So wondering, like, what types of barriers are unique to pharma marketing, and what have you done to overcome those?
Yeah. So twofold. I think one, as it relates to data and technology, data privacy is such a focus right now. And so that's not necessarily pharma specific, that's industry specific in general. So what data can we capture from our target audiences and how can we use that data to retarget them, to message to them, to create content that we think might resonate with them because we know how it performed today. And so we have a wonderful data privacy lead within UCB who's great at helping us identify and understand that evolving landscape. And then from an IT standpoint, we can implement on the back end on our websites a unique experience based on where a user is coming from. So what geography, and therefore it's state specific. But I think that is a challenge and a barrier that will continue to persist and evolve regardless what industry you're in, but it's particularly sensitive in pharma because we're talking about patients and we're talking about healthcare conditions, The other challenge and barrier that I would say for pharma is related to medical, legal, regulatory review. So the promotional clearance process or the ad promo clearance process. And we are talking about a fundamental and seismic shift in terms of how reviewers are reviewing content and what they are reviewing. So they are familiar with the agency of record model, where everything is created net new, bright, shiny object, and they review 100% complete pieces. They see the whole piece altogether and can review the whole piece altogether. And as we think about shifting towards scalable content, they're going to review things in a more modular way with different variability of, in an email, headlines or images or body copy. And they have to get comfortable with those elements of variability, right? And they have to get comfortable with not seeing final complete assets, right? They're going to see probably one or two versions of it, but not every single permutation of that. And so I think from my perspective, it's super important early to get them involved early so that your medical, legal, regulatory reviewers understand what are we trying to achieve? Why does it matter, first and foremost? And with that vision in mind, how can we get there together? How can we get them comfortable with it? I think that's one learning from my side from my standpoint. I think too, having really clear business rules in place is super important as well, so that medical, legal, regulatory get comfortable with, we understand what can go together, what should go together, what must go together, what absolutely cannot go together, et cetera, such that we're making sure that anything that we convey on the back end is done in a compliant manner. I think that's critically important as well. But yeah, I'd say data privacy and the medical, legal, regulatory review process are the two biggest kind of challenges that we're still working through.
Yeah, absolutely. And those are the ones that come up most frequently in any of these discussions. And really appreciate you starting to talk about what are some of the solutions, especially around the MLR process, because that is certainly that is a unique aspect of pharmaceutical marketing, and the idea of getting them involved early, helping them to understand the big picture is that's great guidance for everyone. In your experience, are you finding that your relationships with the MLR teams are progressing along those lines, or do you feel like there's reason to be hopeful in this process?
I think so. So fundamentally, we are all consumers, right? Like our healthcare professionals, our patients, our medical reviewer, our legal reviewer, we are all consumers. So the premise of delivering a personalized experience, to your point, we've all lived those Amazon experiences. So the premise of that resonates with people. It makes sense. Do they understand how that happens? Maybe not. Do they care how that happens? Probably not. That's my job, right? But they understand it fundamentally. And I think too, to your earlier comment about companies striving for efficiencies, those functions are no different, right? So they are asked to do more with less. They are seeking to find ways that they can save some time over here so that they can reallocate to have somebody focus a little more over here. And so the end state vision of driving efficiency, of you're not going to have to review 100 materials, you will review 5, is great. Like fundamentally, that makes a lot of sense to review function reviewers, but also leadership. At the same time, the how is like the most important piece, and the devil's in the detail there, and so making sure that you have their input along the way is critically important, so that it's not done to them, but rather they're a part of the process that you're creating. But I think there is receptivity, to your point. I definitely think there is, because we're all trying to do more with less across the board.
That's very encouraging. I want to get to the data aspect of this in a little bit, but we spoke a bit about the importance of the patient and keeping our mind on the patient on this. But a lot of the content that we're creating now is actually going to the prescriber. And I'd like to turn a little bit of attention to that audience, specifically around how they're consuming content. And what do we know about their expectations? What do we know about their desires? Are their needs changing? Are they actually asking for this, or is this something that we're, forcing upon them?
Yeah, no, it's a great question. And I think, so first and foremost, healthcare professionals are consumers too, right? Like I said. And so if you think about it, it's funny. I read a stat a couple of years ago. So 2022, Gartner did a study. I don't remember the exact percentage, but it was something like 2/3 of consumers expect a personalized experience. Not only, it's not like we find it creepy, we know you're tracking us, you got our data. They fully expect us to use that data and provide that personalized experience. And this year, Ernst & Young did a similar study, and they found that 2/3 of consumers actually won't even engage unless it's a personalized experience. And so in pharma, we're a little bit behind the curve because we don't have that direct attribution link between like, saw this banner ad, bought that dress, the process, the path to prescribing and also to get a patient on drug is much more complex than just click a banner ad, buy a dress, which makes it challenging. So we're a little bit further behind in pharma, but at the end of the day, HCPs are consumers as well. And how and where they're engaging is changing too. So if you think about it, a few things, like number one, they continue actually to find print journals super important. So we saw the world kind of move away from print, and yet physicians find that one of the most important and impactful channels that they engage with, because it's kind of clutter free at this point, which is nice, right? So that's an easy opportunity to be somewhere that oftentimes our competitors are not. But then as it relates to, all the different channels that are coming into play, physicians are in social media as well, right? Like they are consumers. So establishing a presence across Meta, across Twitter or X, for example, like those things become really, really important so that we are where our physicians are. Similarly, connected TV. We have data to know if the household is likely to be an HCP household, and therefore can we serve our consumer TV spot in a home that we know is probably one of our target physicians. Those kinds of things that become critically important, because for a little while, the world was focused on push advertising, like shouting from the rooftops, whatever we want to say, and who knows if anyone listens. Then it was focused on pull. So how do we get people to our websites? And now it's much more dynamic. Like the expectation has become that we do a bit of both, but we do so in a way that's really personalized and thoughtful about where and how our HCPs want to engage, right? So being present in all of those channels becomes critically important for us.
So just getting into the data aspect of this, right, becomes so critical, because it's this combination of how do we actually find individuals, and then what do those individuals actually want? And I'm wondering your thoughts on being able to get more data. So you'll have prescriber audiences that are getting inundated. They may look on a data profile that they may have interest in a very wide range of topics and therapeutic areas and different brands, but in practice they may be a little bit more narrow in that. And so the question of what's going to be most relevant to them, and what are they most likely to engage in and feel like they're not being randomly bombarded, very important. So just interested if you could talk a little bit more on the use of data in that, and how we understand people and how we leverage it to actually make personalization and relevance matter.
Yeah, so I would say, I think data is fundamental and foundational, but taking that one step further, insights are also critical, right? Like what insights are we seeking to glean from that data, and how can we use that insight to then optimize what we do next, whether that's where and how we deploy through what channel, whether that's what content we create next based on what performed. And I think upfront, as we're planning, market research is critical, right? Gaining a keen understanding of our customers, where they are on their customer journeys, how we segment our audiences is super important to the content we create. But then down the line, where and how they are engaging, what channels, how do we deploy that content in a meaningful way becomes important as well. And then generating insights all along so that we can optimize is super important. So yeah, I think it all definitely connects. I think it's interesting to me, our media agencies sit on a treasure trove of data, right? They know where people are engaging, how they're engaging, what they're engaging with. And so I often ask them, their lens is to report from a channel or tactical specific standpoint, because they want to know, did this website perform better than this website, which matters for them. But what matters to me is also what content is resonating and why, Right. The other thing I would say related to like market research and insights is there sometimes is a disconnect in what people say they want. Like, oh, I like this channel, or I prefer to engage through that channel, versus what they actually do. And that's where technology becomes so important to understand. Like they say they really like that, but actually they've never clicked on a link from that channel. So hang on, maybe we actually do need to serve them this other experience just to test it out and see if that might be a better opportunity for them to engage in a more meaningful way.
So it's interesting because you're fusing a lot of different inputs in terms of how you're approaching your communication strategy, and that requires people from different teams coming together and reporting on this. I'm wondering how do you organize your teams, and how is that? What does a typical group look like that's coming up with these types of strategies?
Yeah, great question. So you're absolutely right. So much of what my team does is dependent upon support from and partnership with cross-functional partners across the enterprise. advanced analytics, insights and analytics, the data team, the technology team, right? Like we partner very closely with them. So from a team structure standpoint, my team in the US really has two core accountabilities. We're focused on campaign execution. So customer understanding where our customers are and how we can reach them in the best possible way, deploying content through the channels, optimizing accordingly, and orchestrating those experiences. That's one piece of their role where they partner and they report to me, but feel like they are a part of the brand teams. And then the other part of their role is capability building. So thinking long-term about the omnichannel capabilities that we should be building over time and working in close partnership with all of those cross-functional stakeholders to figure out how do we get that work done? How do we continue to progress according to our plan and our vision? So we actually, trying to think, maybe a month ago now, we met as a broad team. And the conversation that we had, and we do this a couple times a year, but the conversation that we had was, I fully recognize that omnichannel, what I do, is a small piece of the puzzle of what my digital technology team is accountable for the enterprise. It's a small piece of the puzzle for what the data team is accountable for, or the analytics team is accountable for. But for one day, let's all sit together in a room and flip that narrative and talk about all things omnichannel and where all of these pieces come into play. And it's an interesting dynamic because, as you think about influence within an organization, it's very much influence without authority, right? It's very much making sure your stakeholders are on the same page, working towards the same vision, and are a part of crafting how we achieve that vision and what needs to happen along the way. And I have a keen and acute appreciation for other expertise. I'm very willing to raise my hand and say, I'm the omnichannel expert, but that is such a great technology question. So let me bring in that person to answer that question, which I think is critically important as well. Just being humble through it all and understanding the limitations of your own knowledge and therefore where you can respect and be thoughtful about bringing in the knowledge of others across those cross-functional stakeholder matrix.
Fabulous. Okay, I think that we've actually just set a record for the longest conversation that hasn't mentioned AI.
Oh my gosh.
Because we've talked about a lot of different types of data and technologies that help to inform this, but AI, of course, comes up so frequently in conversation and in the work that we're doing. And I'd like to get your thought, not just on your side, but how you look at the agencies that you work with, and potentially as you envision this agency of scale. What would your expectation be in terms of AI, automation? How does that help to scale concepts and content, and what would you be expecting to see?
Yeah, great question. I think, so to separate it into kind of AI first and then automation second, because they are separate buckets, although they're very related. Related to AI, first and foremost, oh my gosh, such a buzzword right now. Gen AI gets thrown around all the time. And I'd say 95% of the examples that I hear about Gen AI aren't actually Gen AI. It's probably more machine learning, if anything. However, I think the opportunity for Gen AI in the agency world is to be a brainstorming buddy for right now. So to be, rather than having a world in which, a team full of copywriters sits together to brainstorm all the different ways we could create a claim, we could create headlines and body copy and things like that. Now, ChatGPT is your brainstorming buddy, right? Same thing with design elements of creative. So thinking about AI as your heat mapping buddy, where I'm thinking about this banner ad design, but where does the human eye naturally look when they look at this banner ad? And does that mean that I should actually move some things around a little bit to make it more aesthetically pleasing and to make people notice what I want for them to notice? That's where AI comes into play. And it's quick, it's fast, it's cheap, right? It's technology. It's not a team of humans working on that. But humans will always be important, because even if AI is your brainstorming buddy for copywriting, what if AI comes up with claims that aren't compliant and aren't exactly on label? Or if it's your design buddy, what if it creates a design that's beautiful, but then it throws off balance the proximity and prominence of fair balance to the claims that we're making, right? So there will always be a human component, even if AI is helping us create stuff on the front end, there will always need to be that human interface, that human check and balance. So it's not that AI is taking over our world or taking over our jobs. It's making us smarter and more efficient on the front end. And then we can be the strategic minds making decisions that are right for the business on the back end of that brainstorming output.
So that,
I think, yeah.
go ahead, no.
No. I was going to switch to automation. So,
Well, let's, because what you're talking about, and I think, we can go deep into the automation side, but you kind of touched on the creativity, I think, and what it is that we're actually the product that we're creating. And I think that where scalability ends up becoming so prioritized, we still need to figure out how do you balance that creativity with the need for repeatable, scalable outcomes, everything. And so you touch on the importance of humans being involved in the process, but can you go a little bit more on that? Let's double click on that and talk a little bit more about how do you strike that balance with creativity and scaling content?
well, I think agencies of record being so good at what they do and having the expertise, my expectation is that they are the ones guiding the decision making. What should be the priority? What should be truly a human working on something versus where can technology step in to support? So prioritization within their own shop, within an agency shop, is super important. And understanding what are those core materials where you really need a heavy-handed human touch. So thinking about things like our TV spot, or our field sales aid, or our print brochure, or our journal ad, things that are heavy in claims. They're oftentimes pretty complex in the review process because they contain a lot of claims, those kinds of things that need more human elements than perhaps AI. Whereas as you think about, okay, now that we have these core materials, how do we create personalized offshoots of those core materials? That's where technology can come into play and AI can help us. I think one element, though, that I will say that I haven't seen yet, but I'd love to see our world moving in this direction is agencies are using AI as a brainstorming buddy, right? It's happening. We know that. But we as clients aren't seeing yet any savings as a result of that, right? So if you no longer have a team of copywriters, you have one copywriter who's brainstorming with AI, with a guarded, gated ChatGPT, then we should see some savings in terms of what is our resourcing plan, our staffing plan within any agency, and how does that evolve over time? And I've been outside of the agency world for long enough that I don't know how that's evolving, but I would love to see that evolve, because ultimately that should be cost savings that could be delivered to the business and or reinvested into more thought leadership and strategic thought leadership at that.
So as a CEO of an AOR, I would love to have a conversation. I'm hoping that Indegene would actually let us do a whole session on AORs at some point. But as we think about this kind of future where AORs need to scale more, I think, do you see, I guess going back to the original premise, do you see validity in a notion of AORs turning more into what we're calling AOSs, is an agency of scale that they need to evolve differently? It's not just about the pricing, but that it's about the ways of working.
Yeah, I certainly see that coming to the forefront. And I'm familiar with several agencies who have moved in that direction, like essentially tiered agency models, wherein you have your tier one bright, shiny object, but still under the same roof and at the same agency. How do you create scalability with a bit less white glove service, a bit more technology enabled creative design and development, right? And therefore pass through those savings to clients. And I think that's important. I think it's very important that we think about our ways of working and who's doing what and why, to your point, because ultimately gone are the days of you need a senior art director in every single conversation, right? Some conversations, and prioritize where they are present and what value they bring to that conversation, but probably not everything. Down the line, in order to enable efficient, scalable personalization, there's a need for a more efficient model that might not have that senior art director in every conversation, right?
Right, right. Well, I'm could go on talking with you for so much longer about this. It's fascinating. I'm getting some signals that we're running short on time. So I just love you. You've offered so much great advice and guidance. But just in closing here, I think, look, you and your organization, your team clearly made just great progress in the scaling content world. And for the people watching this who may be at more like early stages of transforming their own companies, is there any just general guidance you would give them? Where do you start? How do you get going? What should they be looking out for?
Interesting. Well, thank you for that. I think great progress, yes, but still work to be done. And the work, in fact, is never done. I think the minute you think or you think you figured something out is the minute technology catches up and there's something new that you should be catching up with. So, but I appreciate that. I think I would say, setting small milestones along the way is so important. So start small. Don't boil the ocean at first, right? Think about what matters the most for your company and what can drive the biggest impact and the most meaningful results. Start small and then chip away at it, because something like this is really daunting in totality. When you think about the end-to-end content continuum, how we create, review, approve, produce, deploy content, it's daunting. So pick the pieces that you think you can create the most change and drive the biggest impact, and start there. Start small and then celebrate those milestones so that the organization sees you're making progress. Your team is proud of what they've delivered. And yes, it's a small step, but it's huge. It's like a step in the right direction, right? That'd be point number one. And I think my other piece of advice is just be humble, be nimble, be curious. Like I said, I love events like this because I get to learn from others and what they're doing and what's working and not. And like I said, the minute you figure it out is the minute something new pops up. So just always being curious and seeking to learn more. And even if you think you're doing the best, it's probably not the best. It probably could be even better. And at the end of the day, it should be better to better support our healthcare professionals and our patients. And that's what matters. And so always keeping that in mind, and being curious along those lines is so important in what we do. And getting comfortable in not being the expert ever. Super important. You got a bunch of experts around you, but you're probably not the only one, right?
Sage advice for sure. And thank you so much for sharing your thoughts and insights and experiences. This is such a rapidly moving area of our industry. I'm thinking it would be great to have making a little plug here, a follow-up conversation at next year's IDS and see just how much has changed from this year. But for now, I think we'll need to wrap this up. Look forward to speaking to you more in the future on this. And so I'll just say thank you so much, Jen, for being our guest here today. And also, this is the last session of today, so I want to thank you all for joining all of the sessions that you've been at. Remember, there is another day of great discussion tomorrow, so we hope to see you all back here for that.
Great. Thanks, Jeff. Thanks, everybody.
Thank you.